Psoriasis is the most common autoimmune disease in the U.S. It affects as many as 7.5 million people. And here to talk about Psoriasis Awareness Month and the link between the condition and cardiovascular disease is dermatologist Dr. Michelle Pennie. And Dr. Pennie, thanks for being with us this month. And I did not realize that this was Psoriasis Awareness Month. So tell us, first of all, for those who don't know, what is this condition?
So psoriasis is primarily a skin disease, and it's known to cause red, scaly patches on the body. It can be on the scalp, it can be anywhere on the body, but it also can affect the nails as well as the joints.
Okay, and what causes it?
Well, it's a combination of having the genes or the genetic predisposition to psoriasis, and then some sort of trigger. Sometimes it's stress, it's infection, injury to the skin. Some patients don't have a trigger at all, they just develop the disease one day.
Okay, and what is the link between heart disease and why are these people at a higher risk for heart disease if you have psoriasis?
Well, we're really learning a lot about psoriasis. We used to think it was just a skin problem, and recently we've learned that there's a very strong link between those that have psoriasis have much higher risks of heart disease, so that's heart attack or stroke. And there was also a recent study just out this month that showed when you treated psoriasis with systemic medications that your risk for heart attack or stroke went down.
Oh, wow. And explain to people what an autoimmune disease, what that means.
Well, autoimmune, so it means your immune system is not working correctly. So instead of your immune system only attacking what you don't want, bacteria, viruses out there, it's attacking your own body and causing disease.
And often inflammation.
Yes.
And that's what you're seeing with the psoriasis. Okay, so what are the treatment options available?
Unfortunately, there are a lot of treatment options. If you have one or two spots on your body, then we can just treat it with creams, different types of steroid creams or vitamin D creams. When you start to getting many areas affected, then we look at light treatment. These are actually light treatments done in a physician's office with either UVA or UVB rays. And then the more involved, you have joints involved or just a full body involvement, then that's when we go to oral medicines. And there's older generation of medicines that work to decrease inflammation, and then some newer biologic medicines that are a little more targeted therapy.
Okay, and if you have psoriasis, what can you do to be preventing your risk of heart disease and stroke?
And all that. Well, a lot of the risk factors for heart attack and stroke are the same risk factors for psoriasis. So having a high BMI or being overweight, smoking, alcohol use, inactivity. So working on all of those areas can decrease your risk for both.
Okay, so that would decrease maybe the instances of having the psoriasis as well.
As well, yeah.
Okay. And help your overall health, of course.
It'll help your skin and help your overall health, so always good things.
Okay, and if you are having an issue, you can see your dermatologist.
Yes,
decide the best treatment plan.
Absolutely.
Okay, well, thank you, Dr. Pennie, for being with us.
Thanks to be here.
And we'll be right back.